right, good evening, everyone, and welcome to Atp Live Monday. Welcome. I was going to start late today, but I got myself on time. So, welcome, whichever platform you're watching from, Facebook, Instagram, YouTube, any platform you're watching from, you're welcome to ATP Live Monday. I am Bemisola Boyde. I'm a pediatrician, and I'm just going to be answering your question that you may have of any children health issue for the next 1 hour. So feel free to drop your question. And I'll try and answer them. But before that, let's just try and share the video and invite our friends and family to be part of this. Okay, I'm trying to log into my Facebook. All right. Let's share the videos and let me just see what's happening. Okay. Just a minute. I'm trying to log into my Facebook and it's giving me a lot of problem. All right. I'll just click forgotten password. All right. Welcome everyone. So if you have any question, feel free to drop your question on our Facebook page, whichever platform you're watching from, just drop your question and I will try and answer them right now. All right. I'm still trying to log into my Facebook on my laptop, so that's what is causing problem. 9429. All right. Okay, I'm in now. So that I can also make sure I share and I pin it. That's why I need to log into my Facebook. All right, can see those of you already dropping your questions on our Facebook, on Instagram. Just give me 1 minute, just to make sure we share the videos and then we can start. All right. Just 1 minute. I'm going to go off and come back. All right, I'm back. Sorry for the break. Okay. All right. So thank you so much. Yes, welcome everyone. Welcome. So we just share the link to my Facebook and then we can all get ready to start. Just drop your questions. Whichever platform you're watching from now, you can drop it. And then we will be ready to kick off. Just 1 more minute. I just got into my my Facebook, so I'm ready now. All right. Thank you so much for joining us. And just to remind us what I'm still sharing about our project, our first aid care project, the program has finally started. And I'm sure we'll be in a school very near you. But just also let you know that all the resources are available online, the online course as well as the booklets you can download. I will make sure I share the link very soon. And if you want to support us, please, all our contact details on all our platforms. So those of you who are watching on Facebook, you can see my back, so you'll be able to see it. For those on Instagram, I'm sure we'll be able to share the link to you later on. Okay, okay, I think we can start answering questions now. I'm almost done with all my sharing. Okay, just two more places to pin and then we're good to go. So if you're watching on Facebook, please drop your question. Let me know you are there. I can see Instagram people already. I guess that's all. Okay, yeah, I can see you guys on Facebook as well. Okay, so let me formally welcome you all. Welcome to ATP Live Monday. For those of you who are watching from Nigeria, and for those who are watching from any part of the world, you are warmly welcome. ATP Live Monday is a program brought to you by Ask the Pediatrician Foundation, where you get to ask any question that you may have about the health of your children, and you get answers from a pediatrician in 1 hour. However, if you still have questions, remember you can always go to our Facebook group and you can ask your questions, and we'll try and answer them from Mondays to Saturdays. So thank you so much for joining us. Thank you. Thank you. I'm going to just start answering the question because I think I spent some time doing all my connections. The first question on Instagram is for more global properties. Good evening. My son is 5 months old. I noticed one of his legs is always shaking. I don't know if it is normal or I should be worried. Okay, so it depends on what time the leg is shaking. Is it when the child is sleeping or when the child is awake? So usually children tend to shake their legs a bit when they are sleeping. And usually it lasts for just maybe 1 second, you just shake a little and that's it. So we call that benign sleep myoclonus. That is normal. You don't need to worry about that, and you don't need to do anything about that. However, if your child is awake and shaking their legs continuously, and if you try to hold the leg, you can't, the leg keeps shaking, and the child is fully awake, even sometimes the child is crying because of that shaking and all that, that may be a sign of a seizure, or what people call convulsion, and that is the one that we worry about. And so for that, you have to take the child to the hospital so that a pediatrician can have a proper look at the child to make sure if the child is having a seizure, is there any problem going on in the brain, is there any injury and all that. So that is the one we worry about. But if it is the one that happens during sleep and it just 1-2 seconds and the child keeps sleeping, is not waking up and all that, we will not worry about that. But if your child is shaking when awake, please, you need to see a pediatrician for that. I hope you are seeing. Yes, smart and fabulous. Evening. What is responsible for recurrent fever with catarrh in infants? Fever means a child's body is hot, and there are so many causes of why a child body could be hot. And if you're tying it down to catarrh, then which is discharge from the nose, that may be a sign of what we call respiratory infection, acute respiratory infection. But it should not be recurrent, because you said infants and you're saying recurrent. Infant is a child less than 1 year. So if a child is having recurrent fever, there is something definitely not right. So that child needs to see a pediatrician. because children can have cancer, they can have respiratory infections, but we don't expect it to be happening all the time. We don't expect it to be recurrent. So any child who is having recurrent anything, you have to take that child to the hospital and get a proper evaluation to know why it is recurrent. All right, I am Okemsi. My baby girl is 2 years, 4 months. Her hair is falling up like it's going bald. We've seen a dermatologist, okay, who recommended falling up, blah, 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 antifungal cream, but there's no changes. So what you need to do is to go back to the dermatologist. I tend to say this a lot, but sometimes we take some things for granted as doctors. Usually, once you've seen a doctor, you've seen any specialist, and they recommend any treatment for your child, and there is no improvement in that treatment, the next thing to do is to go back to them, because they say, for example, maybe the doctor is thinking of a fungal infection, and that's why they recommend that particular treatment for you. And if there's no improvement, it's either is it that the medication is not working, or is it that the diagnosis is wrong, or is it something else? So, but the doctor who started would know where he or she started from and what he has done and what else could be done again. But if you just go to somebody's house, then they will start afresh, and each time it's going to be starting afresh and afresh. So it's always better to go back to the person you saw earlier. I'm happy you saw a dermatologist who is a specialist for such conditions in the first instance. So once they give you treatment and the child is not better, it does not mean that doctor does not know what they're doing. It means you have to go back for follow-up, for further evaluation, so to know why the child is not better. So because sometimes doctors are also not magicians, and sometimes when we're seeing a child, we're thinking of 3 or 4 different things that could be causing that particular thing, and we may want to go for the most likely one first. And so if the child doesn't respond to treatment, that's the one that will help us to know that, okay, maybe this is not it, or it's something else, or is it that then also the duration of treatment matters. So things like fungal infections, they have to be treated for long, sometimes 2 weeks before you can start saying they're not working. And if your child has lost the hair, you have to wait for the hair to regrow. The hair is not going to grow back the same day or within a week, because you have to first clear the infection. So there are many possible explanations. I'm just giving generic like overview of what could be happening, but I'm not knowing what is specific in your own case. So which is why you have to go back to your dermatologist and let them take it up from there. All right. Yeah, I think I've answered that question. Okay, we'll take last one more question on Instagram and we'll go back to Facebook. Tommy AK1, my baby is booked for Android surgery. Android? You mean adenoids? I guess you meant adenoids. Yeah, so is there any side effects or implication if he's going for surgery? So the best person to have a conversation with about surgery is the surgeon and the anesthetist who are going to do that procedure. And you should have that conversation with them before the surgery. So I really think if you have not had that conversation with your doctor, you should have that conversation with them. That conversation should have been happening or should have happened when they were telling you your child is going to for surgery. As at the time you are taking your decision that my child is going for surgery, that's the time you should ask all your questions about the surgery from the person who is going to do the surgery. So that is the right person to ask, what you're worried about. And they will tell you what your options are. If you don't want surgery, this is the option. If you want surgery, these are the possible side effects of surgery, depending on the type of surgery they are going to do. Whether your child is going to sleep, most likely for adenoid surgery, your child is going to sleep. And then is it going to be going back home the same day, or is it going to stay in the hospital, and all the risks of anesthesia, all the possible things. So that conversation should happen with your surgeon. It is important to have that conversation. And just to let you know that if you go online, for example, and see what are the complications of this surgical procedure, you're going to see so many things, okay? It does not necessarily mean that all those complications will happen. So most children will do adenoid surgery and they're fine, and they're going to go home the same day, and they're eating the same day. But there are kids that sometimes have rare complications. Rare complication can happen anywhere in the world with any surgeon, because number one, some children can react to anesthetics that we don't expect. We call it anaphylactic reaction, idiosyncratic reaction, a reaction you don't expect to happen, but some children can react to it. And I've seen children go for um, this kind of surgery, and just from the anesthetics alone, the children, have to go to ICU because they reacted to it, and that's it. So these are all risk, and that's why you sign consent for surgery, because these things can happen. But the good news is that the people who are going to be there are going to be the professionals, so they know what to do if any of these risks happen. Okay, so there's nobody who is going to tell you, oh, just go and do the surgery, everything is going to be fine. Nobody can give you that 100% guarantee. That is the honest truth. And so, but you pray and hope for the best. Most of the time, 90% of the time, maybe even 91%, most of the children do their surgery and they come out fine, nothing happens to them. But once in a while, we do have those children that give us, we don't expect this to happen, but it does happen. So those are the things. But I always don't like having that conversation, because I think the best person to have that conversation with you is the person who is going to actually do the procedure, or the surgeon himself, and the anesthetist who is going to put your baby to sleep. They should be the one talking to you, explaining to you everything, and telling you what they would do if anything happens. And then, of course, you pray and hope for the best. Okay, yeah, let's go to Facebook. I'll come back to Instagram. Don't go away, stay with us. Thank you, Facebook. Somebody say good evening. What is the best multivitamin? There's nothing like best multivitamin for your child. Okay. Number one, always tell us the age of your child when asking question. But the best food for it's best for your children to actually eat their vitamins rather than take it as syrup or tablet. So what I mean is that give your child fruits and veggies, depending on the age. You didn't tell me the age of your child. If your baby is less than 6 months, of course, just breastfeed. All the vitamins should come from your breast milk. If your baby is above 6 months and they are now eating food, give them fruits, give them vegetables. That's the best way to get their vitamins. Okay, you've told us your baby is 4 months old. So your 4 months old just breastfeed exclusively. All your multivitamins are inside your breast milk. You are the one that needs to take the multivitamins, or eat your fruit and veggies, and everything will go through the breast to the baby. 4 months old baby, two side of head is swollen. What may be the cause? I won't know what is the cause just by you telling me the head of your baby is swollen. I definitely need more information than that. So when was it swollen? Is it from birth? Is it something recent? And 4 months old, have you seen your doctor? I expect you to have seen one. Okay, so there are more questions we need to ask you. I even need to see the baby. I need to see the kind of swelling. I need to touch it. Is it soft? Is it hard? Is it warm? Is it not warm to touch? Is it painful when I touch it? Is it not painful when I touch it? So those are the kind of questions we need to ask before we will be able to tell you this is the cause of this. So many of you have so much faith in your pediatrician, and you assume that we have like superpowers, and you just tell us one line of something and then you expect us to know the cause. No, we don't have that superpower. It would have been nice to have it, but we don't. So for us to make a diagnosis, we need information. We need to see the child. We need to touch the child. So then we'll now think, okay, what could cause swelling in the head of a child? For a 4 month old, did the child had a fall? Because usually I would expect that if your baby had what we call like kefa hematoma or capus, which would have been present from birth, by 4 months they should be going away. They shouldn't still be there by 4 months old. So you have to give us more information to be able to tell you the cause. But you definitely need to see a pediatrician if your baby's had swollen head. In a 4 month old, you definitely should be seeing a pediatrician if you have not seen one, because that is something we don't expect at that age. All right. Somebody said my baby's weight at birth was 4 kilos, and at 4 months it weighs 6 kilos. Is the weight okay? Well, your baby was quite big at birth, but I assume that maybe your baby already lost some weight at some point. It's not too bad, but you need to make sure you're breastfeeding your baby exclusively so you can get better. We usually expect baby to gain roughly about 1 kilo per month. So which means your baby should be closer to 7 kilos, but 6 kilos is still not bad. Just make sure you're breastfeeding your baby exclusively. All right. Somebody said, what causes twitching baby when sleeping? I think I just answered that question. It is nothing to worry about. If you were here when I answered the very first question, that's the first question I answered. If your baby twitch when they're sleeping, it's nothing to worry about. We worry about it if they're shaking and twitching when they're awake and it's making them to cry, or when you try to hold them, you can't stop it, or you see their eyes rolling upwards. Those are signs of a child who may be having convulsion, and that is the one that worries us, and that is one that you really need to take to the hospital. Okay, good news. Your 6-year-old has dull colored teeth and fingernails. What is the definition of dull? I mean, I want to know what you mean by dull. So we expect like maybe teeth could be white, teeth could be light brown, teeth could be creamy. There are many colors of teeth. Everybody does not necessarily need to have like white, snow white teeth, okay? Different colors. So I'll rather you let a doctor have a look at it and tell you whether it's something to worry. The word dull is not very specific, it doesn't tell us anything. So what may be dull to you may not necessarily be dull to a doctor. So it's better to use specific colors and then let a doctor have a look so that we will know what is the implication of that. I really don't know there's any implication of anything dull fingernails. What is dull fingernails? Really, I'm not really sure what you really meant. So I would just think it's better we see that kind of a, and then we'll give you an idea and we will now be able to advise. All right, let's take one more question on Facebook, then we'll go back to Instagram. Uh, you said babies are supposed to unclench their fists from 4 months. Is it totally they are not supposed to clench it at all? No. So most time when babies are born, their hands are always closed. That is what it means. If you have you seen newborn babies, they're always like that. Their hands are closed. We call it fisting. So usually as babies get older, their hands become open. So their hands are always open like that. So if your baby's hand is always like this from 4 months old, then it's not a good sign. It's a sign of what we call hypertonia. It means the baby body may be stiff, and that is telling us there may be something going on in the brain. It does not mean the baby cannot open and close their hands. They should open and close their hand, but we're talking about a baby always keeping their hands fisted. That is not a good sign. So that is what I meant. Of course, baby have to open their hands, and when they hold something, they have to close their hand around what they are holding. I mean, they use their hands normally, but we don't expect them to always keep those hands fisted. That's what we call it fisting. Normally babies are born that way, but the same way when they are born, they're always like they don't relax all their body. They're always flexed, they're always like that. Hands flex, leg flex, but as they get older, they are more relaxed. So usually if we now see a baby from 3-4 months old still very fisted, still very flexed, we will be worried about something going on in the brain and we need to do something about it. Okay. So your 5 months old is able to grab the toys but clenches his fist sometimes. I don't know. It is when it is always closed like that we worry about. And you will notice that when you try to open it, the baby doesn't want you to open that hand. The hand always wants to be closed. If you are not sure, just let a doctor have a look. So that way we will be sure. Somebody said my son is not really drinking water and it's making him to be constipated. How do you just give him water to drink? But when you're giving babies water to drink, you don't need to give them the whole 1 liter in one go. So they can have a several sips throughout the day. So you can put water in with a straw. Some children like the straw way to drink water, or they like all those fancy sippy cups. Just give them a little bit of water throughout the day, and you can give them with spoon as well in their mouth. So each time they feed, you give them a little bit of water. You have to make sure. And your baby is getting constipated at 7 months old is not because of water only. Make sure you are still breastfeeding your baby. Okay, if you're breastfeeding your baby is still going to get so much water from breast milk. Make sure you are giving your child fruits and veggies, and it's not just cereal, pap and milk only. That way they'll become constipated. Make sure you make your porridge or your cereals or whatever you're giving them, make sure they are soft food and all that. So you need to make sure you are taking care of all those other things as well, because how much water would they drink? Maybe about 50 mils, but most of the liquid will still come from your breast milk. And then, of course, they need to take normal water as well. All right, thank you. Let's go back to Instagram and we'll come back. Farmatas apparel. My 2 month old leg trembles sometimes when eating or crying. Well, when eating, sometimes maybe when they are crying, they shake their body, they move their body. I won't worry about it. But when eating, your baby's leg should not be shaking. So what I'll tell you to do is hold the legs, hold it and see whether it stops or it continues. If it is stopping, could just be something you may not be, won't worry about, but if it's not something you can stop and it goes on, and especially if it shakes for so long, then I will worry about that, and then it's better you see a pediatrician about that. All right, okay. Then that is Instagram all done. Let's if you have questions, feel free to ask. Somebody said my 9 month old baby doesn't have any teeth. Should I be worried? Oh no, you don't have to be worried. Some babies don't bring out any teeth until they are 1 year old, 13 months old, and that is still normal. It's still part of normal variation, so it's nothing to worry about. But the dentist want to see your baby at age of 1 year. So from 1 year, please see the dentist, and they will take it up from there. Whether the baby has it or not, just see your dentist at 1 year. My baby at 4 months hasn't started sitting on his own. Sitting is not 4 month old skill. So please, before you start worrying and panicking about developmental milestone, know what is normal. Many of us don't know what is normal. The number of times I answer questions, my 9 month old is not working, my 6 month old is not crawling. It's because we don't know what is normal. I mean, I don't expect a 4 month old to sit. A 4 month old should have neck control. That is what we expect a 4 month old. Sitting with support is a 5 to 6 month old skill. Sitting without support with the back straight is 7 to 8 months. Crawling 9 months for those who will crawl. Some babies don't crawl. Some babies move with their bum. We call it bottom shuffling, and it's also perfectly normal. Standing 11 to 12 months. Walking 12 months, but even then that is just the average. So some babies may do it a little bit earlier, some may do it a little bit later. So for example, there's now a cutoff age. So I will only worry if your baby doesn't have neck control at 4 months. Okay, that is when I'll start to worry, not at 3 months. Then if your baby is not yet sitting at 9 months, yeah, that's when we start to worry. And if your baby is not yet walking at 18 months, that's when we worry. We don't worry when your baby is not walking at 1 year. 50% of baby walk at 1 year, but some will still walk 14 months, 16 months, and it's still normal. So you need to know what is normal first. So if you go to our Facebook or you go to our website, www.axipediatricians.com, there's an article on developmental milestones so that you can reiterate, know what is normal. And some of you in your baby card, I think we write this in some of those, your immunization baby record card, the developmental milestones, there should be one page there about it as well. So you can also check it as well. So know what is normal so that you don't start to get worried. Why should you be worried about 4 month old not sitting? 4 month old don't sit. That's not the time for sitting. All right. Somebody say my baby is not fed immediately after birth. The baby needs to be fed within 1 hour. It doesn't have to be immediately. 1 hour. We want them to be breastfed. So that's it. And what is the problem now? And stop worrying about what has happened in the past. How old is your baby now? Is there any problem now? I don't think it's important for people when people ask questions about maybe what they should have done that they didn't do. The question is, how is the baby now? Is there something happening now that is bothering you and you think is linked to that? If your baby is otherwise well now and fine, there's no reason for you to start thinking about, oh, maybe they didn't. Some people tell me my baby is breathing so much because they didn't suck the baby at birth. Come on, there's no way not sucking your baby at birth will now be affecting your baby 5 months down the line. It's not possible. So all those things, we really need to know what is the current state of the baby rather than what has happened in in the past. So we want baby to be fed within 1 hour, and most good hospitals will also check your baby's blood glucose level, just to make sure that the glucose level is fine, especially if you are diabetic and all that. Those are the ones that we worry about, your baby's blood sugar being low, and otherwise there should be no problem. All right. Is it when a baby shake his leg is bad? I'm not sure I understand that question. And please always say the age of the child. Every question has to be in context. Okay. There's something like baby having leg control. It's neck control, not leg. Babies don't control their leg. So neck control is when babies are born, most of them, that their head is always, they are not able to keep it, straight and all that. It's always falling to one side. So, but by the age of 3 months, 3 to 4 months, then they're able to keep that neck straight. So when you carry the baby up, you will notice that their neck is not falling back. It comes up with the rest of the body. That's what we call neck control. So usually by 3 months, most babies have neck control. So maybe a little bit late, but by 4 months, we expect all the babies to have neck control. If they don't, then we worry about developmental delay. So that is what that means. It's not leg, it's neck control. I hope that is clear. Right. I don't think I have any more questions on Instagram. Okay, I think I've rushed through the questions. So if you have any questions, feel free to still drop your questions and we'll try and answer them. We still have half an hour to go. And okay, so people have dropped questions. I was going to go into something else. I'll do it at the end. Good evening. My 4-month-old baby has cough catarrh. Went to the hospital. Doctor prescribed drugs. 2 weeks, no improvement. You have to go back to the hospital. I notice he's bringing out teeth. It is not the teething that is causing the cough and the catarrh. Mouth is always warm. Our internal body are warmer than our external body. Is it some teething? No, it is not teething. Birth weight is 3.4. Current weight is 7.9. On exclusive breastfeeding. Good. All right. So cough and catarrh for 2 weeks is most will last 2 weeks, but after 2 weeks, by now it should be going. So if it is still going on for more than 2 weeks, you should go back to your doctor. Most of them don't require all these drugs anyway to start with. And please let's stop let's just stop the teething for everything. All right, everything is not teething. Most children have teeth. I mean it was so serious. Like when mother was like, "Oh, my baby just have teeth," and I didn't see any symptoms. I'm like, "Are you supposed to see any symptoms?" It's not compulsory for babies to have any symptoms when they bring out their teeth. Okay, stop making this teething diagnosis. Teething is just like any other developmental milestones, just like your baby walking, your baby crawling, your baby sitting. It's the same way they bring out their teeth, and it does not make them sick. It does not give them fever. It does not give them cough or catarrh. It does not give them diarrhea. It does not give them any symptoms. Okay, and we don't have to blame teething for anything that happens at the same time that teething is happening. So it is just something happening together, but it's not a cause and effect thing. So please, let's stop. And please don't give the teething powder or teething mixture, because that's the next addendum to that question. So this question I started with, "Oh, I noticed it." Then is it teething? It is not. Then should I give teething powder? Please don't. Do not give any teething, so-called teething powder, teething mixture to your children. They do not need them. All right, just leave the children alone. Okay, keep your baby warm, breastfeed exclusively. If you are taking your baby to crash, they can always get cough and catarrh from other people that have cough and catarrh in the crash or daycare. Also, if people at home are coughing, having catarrh, they can also give to the children. Otherwise, there's no way the child is going to get the cough and the catarrh. All right. For matters, we've answered your question. Your 2 months old baby leg, I've answered that question. I've answered it. I've already told you, if your baby's leg is shaking when eating, that is not normal. Hold the leg, see whether that shaking stops. If it stops, then there's nothing to worry about. If it doesn't stop and your child keeps shaking the leg for so long, you have to see a pediatrician. So I think I've answered that question, but you've asked this again. So it's the same answer 4-month-old will be always showing his gum. What could be the cause? There's no problem. Everything is not your problem, okay? Everything is not a problem, all right? So you try chewing their gum, there's nothing wrong with that. Children also, sometimes children, when they take their breast milk, sometimes they still keep a little bit behind and then they make that movements of them. I won't call it chewing because you need to have teeth for you to chew, really. So the movements of their mouth that you see, especially when they're swallowing the breast milk and all that, does not mean there's anything wrong. So everything is not a problem. All right. So you don't have to do something about everything that you see in children. Some things are just normal thing for babies to do, and it does not mean they are wrong or does not mean they need to be fixed. Okay, before I can't see any more questions, so I just want to remind us now that the human papilloma virus HPV vaccines are out. It has been launched by the federal government last week. So most of the health centers have started giving it. I think they're even going to schools to give it as well. Please let your daughters take the HPV. I was informed that some of us are refusing to take the immunization. People have some lots of myths around immunization. I was told some people think, oh, they are using it to control their fertility or control their population. All those are not true, okay? These vaccines are meant to protect our children, especially our girls, from cervical cancer. Even we adult women, we should take it. It's supposed to protect us from cervical cancer. Cervical cancer is one of the most common cancer, right? That's the next to breast cancer in women. And so, if it's something that we can prevent, and I've seen young women die from cervical cancer, so it is not something that is just for the elderly only. So, and one of the things that has been reliably linked to cervical cancer is the HPV virus, the human papilloma virus. And when people have that infection, you will not have any symptoms, you will not even know you have it, but it can cause cervical cancer down the line. So giving our children the HPV vaccine will protect them against that in future. So please take the vaccine. It is safe, it is reliable, it's okay. You can, on our website, I think on our Facebook group, we've posted the video from UNICEF talking about it, how important it is. So let's make sure that we give our children the HPV vaccine. So go to your health center, ask them whether they have, so you can take it for your daughters, 9 to 14 years. And if they don't have, some are going to schools. If they bring it to the schools for your children, please give them the permission to give it to your children. I think I will talk more about it this Thursday on my ACP hour. I think I'll just take a little bit more in-depth look at human papilloma virus and the HPV vaccine, so that we can all ensure that our children are protected from it. So if they're giving it in your state, please go for it. If they're not yet giving it in your state, be patient. It will come around, and so please make sure you give it to your children. This is vaccine they've been giving in other countries for so long, so it's not as if it's something new. It's always been there. It's just that we've not been giving it in Nigeria. And when we started ATP, then people will have to pay for PCV, pneumococcal vaccine. And remember that we used to encourage people to go and pay for it if they have the money, but now we're giving it for free. The same thing with HPV. It has been there all along, but people have to pay for it. I have to pay for it when I took mine, but now it is available and it is free. So please take these vaccines. Some of the time, because government give us some of these vaccines for free, we take it for granted. We think those vaccines are expensive. Somebody is paying for it, so the government has paid for us. So your own role is to make sure that you take your children and they get the vaccines, and it is safe. So you don't have to be scared or anything, and there's no hidden agenda by anyone to depopulate the world or to cause infertility to our children. No, let's let's go of all those myths. Let's make sure we take our children for this immunization. So that's the reminder, because some of you said I should remind you again when they say giving it. So this is me reminding you now, and I think we'll still put it up again on our Facebook group. Please make sure you take your children, the girls 9 to 14 years. Make sure you ensure that they get the HPV vaccine. All right. And if you have any question about the vaccine, feel free to ask, and I will try and answer them as well. All right, I got one more question now. Please, ma, what can make a baby of 3 months crash the size of her hair? Babies crash their hair a lot, but the commonest thing that tends to cause that is the product you're putting on them. And some of you like to put this oil on baby's head per second, like you just be putting all those myths about the anterior fontanelle, that it must not be dry, you must always put oil on it. It's not true. You don't have to put oil, because the problem is that those oil will not start dripping down the baby's face, and then it will be, some of them are irritating to the children, and then that's why they scratch. So make sure you are not putting too much oil. Or it could just be that the baby is also sensitive to whatever product you're using on their skin as well. So also check that. Okay, you've noticed there's heat rashes on her scalp. Usually heat rashes don't happen on the scalp. So whatever rashes your child has on the scalp, you need to get a doctor to check it out. Heat rashes tend to happen on the face, on the what they call it, the chest, and not on the scalp, unless you are also wearing cap 24/7. Again, that's something we all do. My mothers do a lot in Nigeria. And please, it's not compulsory that babies have to wear caps. If the weather is not cold and all that, you don't have to be putting caps on them. Just let them be, so there's no need for that. But just let them check whatever it is on the scalp. It's not a very common place for it to be heat rashes, and all rashes are not heat rashes. So mothers like to call rashes either heat rashes or measles or chicken pox, and those are the three explanations for all rashes in children. That's not true. There are many other things that can cause rashes in children, and one of the commonest one is our products, all these things we are rubbing on our baby's body. Sometimes they can irritate them, they can be sensitive to them, and that can lead to rashes. So, and sometimes it's as simple as stopping that product and using something that doesn't have much chemicals, something that is natural, like your shea butter, your coconut oil, your Vaseline. Those are very okay for most people. Most babies don't react to them. So that's what you need to do. And if your baby is rubbing the eyes as well, make sure it's not like something is dripping into the eyes. Do that. So, but sometimes your baby can have some allergies as well, and that may make them to rub their eyes, and you see that their eyes is always looking brownish or red. And in that case as well, you just need to also we need to know what it is the child is allergic to or is sensitive to, and try and see if we can stop it. If we can't stop it, then we may need to just give some medication, anti-allergy medication, which your doctor can prescribe for you. All right. But just deal with all the possible features first before you go on to very unlikely stuff. Long time, Millicent, you're welcome. Thank you for joining us. Somebody said, please, what's the cost of my 4-month-old? Okay, we've already said there's no cost and there's nothing to worry about. Just leave it alone. All right. I think some of us are multitasking because I've answered your question, but you asked the question again, and I'm like, where were you? So maybe you were doing something else when I answered your question. So please always stay with us. There's nothing to worry about your child chewing the gum or whatever. There's nothing to worry about that. Just leave the baby alone. Okay, somebody said, can umbilical hernia cause a child of 6 years old not to like eating? No, there's no link between hernia and eating. All right. I'm always amazed the way mothers link things together. So the fact that a child has something or a particular condition does not always mean that thing has to be linked to whatever is happening to the child now. No, please, let's avoid that linkage. We do it a lot. The same thing with the teething. So the child is bringing out teeth, then any little symptom that happens, it has to be the teeth. No, things can happen together at the same time and be perfectly unrelated to each other, just coincidental findings, if you like. So it's not the umbilical hernia that is making a child not to eat. And can it be cured without surgery? No. Okay, there are some things that that's so most children hernia will go away by themselves. So usually we usually leave children up to the age of 5 years, and sometimes they, because what causes hernia is that there's a hole inside, so that place where your baby's umbilical cord, what join you and your baby together in the womb, that's area, there's a hole. So when you cut the cord, you expect it to close. That is what's supposed to happen. But for some reason, the hole does not close fully. So when it does not close fully, things that are inside the abdomen, they can come out through that hole, and that is what you now see as the hernia. And that's why umbilical hernia, when you press it down, you see that it will go back, because it's just the hole there. So things will come out of it, and sometimes it can go back easily by itself. But sometimes they can, if it is so serious, it can come out and refuse to come back. Then we say it's obstructed, and sometimes it can even start causing pain for the child. And we call strangulation. Those are complications that can happen. So as children get older, sometimes the hole closes by itself, and you see the hernia naturally goes down. But some children, by the time your child is 6 years old and is still having hernia, it's not going to close by itself. It means you need to do surgery. That is it. And if it's really big as well, if it's a small one, most times they will go back down by themselves. Before the age of 5 years, most times they go back down by themselves, and the hole will close naturally. But if after 5 years it's very big, it's not going down by itself, there's no solution. It's not a drug thing. It is not to put any coin. It is not to be wrapping or tying anything. The child needs surgery. That's it. Because what the surgeon is going to do is to go there, close that hole. That's all. It's a very simple surgery, but they have to close that hole, and that's it. So there's no solution, because I know a lot of mothers, we panic once we hear the word surgery. We panic a lot. Yeah, but most of the time, it's not every surgery that is that we should worry about. Some of them are simple surgery, and it's just a repair, just to close that hole, and most children are fine afterwards. So you don't have to panic about surgery, and there are some things that don't have any solution apart from surgery. So I know most of you want a drug solution or something that will require your baby not going through an operation, but sometimes there's really no other solution. But the surgery is not a big deal surgery. It's a minor procedure, even though your baby may have to be in the hospital, but most time you will go home the same day. You don't have to sleep. It's not a big major surgery like we call it, but because it's children now, most time we put them to sleep. So that's it. But it's not a big procedure at all. All right. Yeah, I've told you the complications. Your baby can have obstruction, baby can have strangulation, and then your baby will still need surgery after the complication. But now we're that kind of surgery we do, we call it emergency surgery. If the because the intestine can come out through the hernia and get kind of fixed, and they can't come back, and they will start to die. They become what we call gangrenous. So, and that time we will not have to do emergency surgery. They will have to cut away those parts of the intestine because they've lost their viability. Your baby is not going to go through a major surgery. So it's best not to wait for that complications and deal with it when you can do it simple and all that. So that's what I'll recommend. All right. I think I have a question on Instagram. Okay. Miss Debbie J. I complained about baby's cough last week. He's still coughing. We're giving him Bonababe. I'm sure I told you not to give your baby Bonababe. Or did you tell us last week? Or or is that something you started doing? Please don't give children Bonababe. That's something we should not be giving our children. Bonababe, Bomaro, What's the other one? All those things, please don't give them to your children. Don't. Don't give them to your children at all. They are not appropriate and they're not good. All right. So if your child is coughing, you didn't tell us the age of your baby again. I'm sorry, my memory is not that sharp, so I can't remember the age of your baby. Um, if your baby is coughing for more than 2 weeks, you go to the doctor and let the doctor see the child. Make sure especially if the child also has fever, child is having fast breathing, difficulty with breathing, those are the time you need to go to the hospital. Most children that have cough and catarrh is due to viruses. They won't have fever, and the cough and catarrh is going to go by itself, usually within 2 weeks. Okay, and the most important thing also to make sure that nobody is reinfecting the child. So we say exclusively breastfeed your baby. Those are the ways to protect your baby against infection. No smoking around the baby, not taking baby to the kitchen, no generator fumes around the baby. Let the house be well ventilated, fresh air and all that. That's all we need to do. And most of the time, the cough and catarrh will go by itself. And if the other ones are also having cough and catarrh, you want to keep them away from the baby. And most of the time, if you take a baby to crash, daycare, it's a little bit difficult because most of the other children are also coughing and having catarrh. So when your baby is supposed to be getting better, they get infected again, and the cycle continues. So please, let's not medicate our babies. Let's not self-medicate them. All right, and some of those drugs we give to our children, we should not give it. Banabib number one is not even for cough and catarrh. That's number one. It is a mixture of chloroquine, paracetamol, and they put it in what we call suboptimal doses. So it's not treating malaria, it's not even treating fever, and your child is having cough and catarrh. So why are you giving that? So it's even a drug we don't use. Nobody treats malaria again with chloroquine. So there are things we should not even be giving, and there are things that NAFDAC should not be approving as well, but people still give it to all sort of things and they're not good. So I'll tell you just to stop it straight away. Yeah, my baby is 5 months old. So yeah. So no Barnaby, please. If your baby is still coughing and you're worried, just go to the hospital and let the doctor have a look at your baby. Okay, Tarama, whatever. Can they operate a baby that has as near as 6 months? Yes, we can operate if there's need to operate. Okay, so operation has what we call indications. There are things that will make you to operate a baby. Most people will not operate hernia at 6 months unless it's very, very big or obstructed or having complications. Otherwise, most time we wait. Like I said, sometimes we wait as long as 5 years for the hernia to resolve by itself. So they only operate if it's a big one. Some we already know, even from 6 months, we know that this one is not going to close because it's so big or it's causing complications already, so we have to operate. But otherwise, we usually wait. So just see your pediatric surgeon. They will tell you whether they are going to operate or not. And there are indications for operating. There are criteria they are looking at that will make them to decide to operate or not. Okay, and that's for the surgeons to decide, not us. um I get a lot of question about whether babies can be operated. Are they too small? We can operate. Newborn babies are operated on, and I'm sure some of you had the story of the baby that was operated on in the womb. They bring out the baby, operated the baby, and return the baby to the womb, and then the baby was born again. So that is possible. Medical science can do all that. So if the baby needs an operation, even newborn baby, they will operate them. Yeah, so it's not a big deal. So there's nothing about age and operation. Operation is, does the child need it or does the child don't need it? It's not matter the age. So if the child needs it, they are going to go ahead and do it. If the child doesn't need it, no, we won't do it. So that is how that works. Tarama Pomisia. I hope, sorry, I'm not sure I pronounced your name properly, but I hope that is clear. Just bear with me. All right. I think our time is winding up. I don't have any more questions on Facebook, but just to remind us that if you still have any question after the live session, or if you are one of those who are watching the recording of this video now, after 7, that will be 7 p.m. Nigerian time, we will not be able to answer your question because the program is no longer live. what you need to do is to go to our Facebook group, and you can post your questions there. So we are always there Monday to Saturdays. I know every Sunday somebody will send me a message to say I can't post on the group, even though we always say it is Monday to Saturdays. And so you can only post your questions from Mondays to Saturdays, and our professionals and our moderators will be there. We'll try and answer your questions as soon as we can. Please be patient with us. Some questions will answer it within 24 hours. Some may take us up to 48 hours, 72 hours. Please don't send it twice. Just send it once and wait, okay? If it's something that's an emergency, like you need an answer now, you have to go to the hospital, because anything you need an answer to now is an emergency, and you have to go to the hospital. But if it's something that can wait, then you are welcome to post it. And just to say that, please, there are some things that we should know, but sometimes I know we're all at different level of stages of this journey. But if your child is sick, if your child has a fall, if your child has taken a poison, or taking something in, those are not Facebook questions. Those are hospital. You have to go to the hospital. So sometimes I see questions like that, and it just worries me, because the longer you waste time going to the hospital, the more dangerous it is for the baby. So please, if a child is very sick, a child has had an injury, an accident, somebody said my baby fell and broke the lips and all that, you should go to the hospital. They may need to suture the lips, they may need to give antibiotics, they may need to give tetanus talks. There are some things we're not going to be able to solve on Facebook. So please always go to the hospital for such cases. Sick children, hospital, please. We don't treat children on the group. We just are more of an educative, informative platform. We don't diagnose, we don't treat. We can only direct to say, okay, this is something. Oh, my leg is shaking, the baby's leg is shaking during sleep. Don't worry about it. You don't need to go to the hospital for that. Or my baby is not eating, or how do I feed my baby? We can teach you that. These are, things we can change. But if a child is already sick or child is already very ill, please, you have to take the children to the hospital. I understand that sometimes finance is an issue, but most of our government hospitals, at least in Nigeria, they will treat children without you having to pay for consultation. They may need you to go buy your drugs. Some of them even give you drugs for free, but at least we will see the children. We will tell you this is what is wrong, and then we can tell you the drugs, even though you have to pay for that one. But at least, so don't use I don't. Some people always ask that question, hey, doctor, blah blah blah, but I don't have money to go to the hospital now. Nobody plans for a child to be sick, but that is part of life. Once your child is sick, it's not a matter of I don't have money to go. You have to go to the hospital. So you're not just going to leave the child to be ill. And I can remember many times, sometimes in the hospital, we look for money to make sure we treat these children. There are welfare finance that we sometimes tap into, and there are people that are generous philanthropists who come to the hospitals who help people who don't have money. So don't use the excuse I don't have money not to take your sick children to the hospital. Still take them there. Let them even tell you first whether it's even you don't need money to treat. We don't know whether we'll be able to get you somebody that will pay for it. You don't know. So at least go, and let us now be the one to tell you, okay, this is what is going to happen. So please, let's not delay taking our children to the hospital. All right. Somebody just saying thank you. May God bless you. Amen. Amen. Okay. Somebody say, can a baby rub her eyes as a result of tiredness? Yes, it's possible. And you will notice that the child is doing it when the child is going to fall asleep. So there are some things we expect us, you figure it out by yourself. But if the child is not sleeping and is always rubbing the eyes throughout the whole day, then that is not tiredness. The child can be tired all day. The child will just woke up and just had a field and is rubbing his eyes. Most likely that is not sleep. That is not tiredness. That could be something else. So there are many things that could cause the same thing. All right, so our time is up. Going to end now. Thank you so much to those of you who have joined us this evening. Remember, if you still have any questions, post to our Facebook group. Remember our ATP School First Aid Care Project. We did the first one today in Plateau State. We'll be sharing the videos and the pictures with you later on. But we just want you to support us as we go to our schools and empower our students on basic first aid care and give them the first aid care booklets, calendars, and stuff. So we will share the link to the online course for those of you who want to tap into it as well online. And we appreciate your donation. Any amount, nothing is too small to support us. Thank you, BC Shums. Thank you, everyone. And I will see you on Thursday. Like I said, I'll be talking about cervical cancer, hepatitis, not hepatitis, human papilloma virus, HPV, and the vaccine that has just been rolled out. Please take your children for this vaccine and let's protect them, the next generation. Let's protect the next generation against cervical cancer. Have a wonderful evening. It is bye for me. Bye. God bless.